In April of my sophomore year at Tufts, I was sitting at the desk in my Harleston dorm when I picked up the call from my dad telling me that my older brother Ben had died. Even 2 years out, I can still feel my body wanting to curl in on itself and protect me from the memories of that day. Ben was an undergrad at Brown University, a really sharp student studying chemistry and Chinese. His professors all respected him. He was making new friends. It seemed like he was finally blossoming. What we didn't know was that he was also using drugs again. Ben dealt with substance use disorder for several years, but he started off experimenting with cannabis in high school, like a lot of people do. And then when he entered college, he started expanding that usage into sedatives to deal with strong feelings of social anxiety, and it just spiraled out of there. He ended up taking time off from college to enter an inpatient treatment program and live in a recovery home before he eventually re-enrolled. Back at school, he was enjoying his new courses, and he was getting more involved in the chemistry department. He was finally listening to music again, and I'm pretty sure he would have picked up his old trombone again soon, too. Ben had a really sharp, analytic mind, but he was also creative, and he was sensitive. And his vast inner world was not something that he often let other people see. I regret that I rarely even got a glimpse. I think of all the things that Ben would have and could have done, all the versions of himself that he might have been if he just had more time. He worked in restaurant kitchens back home, so would he have pursued cooking? Would he have worked in a lab and contributed to some kind of major scientific breakthrough? Would he have come to my graduation this spring, and would I have gone to his? Would he have called me up on the phone one day, out of the blue, wanting to talk and start to repair our strained relationship? Would I have even picked up that call? To all these questions and more, I will never know the answers because the cocaine that he bought that one time was contaminated with fentanyl, and he didn't know, and he accidentally overdosed on it, and he died. And my life and my family's lives will never be the same. For a while, I could hardly even talk about the subject of substances, let alone my memories of Ben. But then still, the following fall, I sort of spontaneously enrolled in the drugs and behavior course here in the psych department, hoping to treat it like a kind of therapy. And in that class, we read Beautiful Boy, a memoir by David Sheff about his son Nick and his decades-long struggle with substance use. From then on, the trajectory of my time at Tufts completely shifted. I became sort of obsessed with Nick's story, reading both of his own memoirs in an effort to chase down something I glimpsed in there, something that looked a little bit like Ben, a little bit like me. This brought me to THREAD, or the Tufts Harm Reduction Education for Alcohol and Drugs Initiative on campus, which teaches students who choose to engage with substances about how to do so in safer ways. This got me really invested in the concept of harm reduction, and I joined a fellowship program this year with SAFE Project, a national nonprofit aimed at ending our country's opioid epidemic. With their support and with THREADS, I'm working to expand the availability of harm reduction resources on the Tufts campus. And it was through both of these engagements that I started to learn more about how pervasive and preventable this type of overdose is. While my loss is unique because Ben was unique, the fact of the matter is that this type of loss from accidental fentanyl poisoning is disturbingly common. According to the DEA, fentanyl is the leading cause of death for Americans between the ages of 18 and 45. So I'm here, motivated by my own experience, to try and help people really understand the scope of this crisis and also the risk that fentanyl poses to the lives of anyone who may engage with substances, even once, and especially when there's no harm reduction measures in place. Overdoses ricochet through loved ones. I now know this firsthand, and I don't want anybody else to experience this pain. So, what is fentanyl? Okay, let's start there. Fentanyl is a synthetic opioid that is 100 times more potent than morphine and 50 times more potent than heroin. You may or may not have seen this image circulated, which illustrates the potentially lethal dose. That's 2 milligrams. Last year alone, 5 out of 10 counterfeit pills seized and tested by the DEA contained this potentially lethal dose. Because it's synthetic, it's easy to produce, and it's also easy to mix into other substances, oftentimes without the user's knowledge. It's commonly found in cocaine, MDMA, methamphetamine, heroin, and pressed pills like counterfeit Adderall and Xanax. And these contaminated drugs look virtually indistinguishable from the non-contaminated drugs. And one thing I keep noticing is this pervasive trivialization and jokiness surrounding fentanyl. Jokes about cooking it up, jokes about addiction, calling it fent. I just keep wondering, where does this cavalier attitude towards one of the most dangerous and deadly drugs in the drug supply possibly come from? It's possible that this is a reaction to the extensive fear-mongering that exists around fentanyl. And while the fentanyl crisis has indeed been a crisis, the misinformation being spread about it really only perpetuates the stigma associated with drug use, and then people just start to laugh at it. A common misconception is that you can overdose on fentanyl by touching a person who's actively overdosing on it. Now, the rate of transdermal fentanyl absorption is far too slow for this to be a real risk. But what is actually dangerous is neglecting to provide intervening care to a person who's overdosing out of some kind of misdirected fear about exposure to the drug that they've taken. This becomes particularly salient when we think about administering naloxone, also known as Narcan, which is a life-saving opioid overdose reversal treatment. It's a nasal spray which can be given to anyone of any age, it can be administered by anybody, and you can't harm somebody if you've given them naloxone when they weren't actually overdosing. Because administering this life-saving treatment is so easy and effective, it's tragic to think about the people whose lives could have been saved, but who died because of misinformation born of stigma. Essentially, what this all culminates in is the importance of harm reduction. The reporter Maya Salovitz, in her book Undoing Drugs, likens it to a physician taking the Hippocratic Oath, not actually to cure, but to avoid worsening their patient's condition. Harm reductionists are working similarly to minimize the damage associated with the substance by reframing and focusing on addiction treatment and drug policy as opposed to abstinence and punishment. Here at Tufts, Thread is prioritizing the health of its students by trying to make harm reduction materials as easily accessible as possible, and we've been very successful at reaching the Tufts student body. I think part of the reason that people are so receptive to Thread's work is because for a lot of people, including myself, our first exposure, in an educational sense, to substance use is through DARE, or Drug Abuse Resistance Education, and its now iconic slogan, "Just Say No." This program began in 1983 under President Reagan as a part of the war on drugs, which aimed to end substance use completely. It utilized police officers entering classrooms to teach elementary and middle school students about the dangers of drugs. And what I remember from my own DARE lessons was essentially, look how your life will fall apart in front of you if you even go near them. Well, that may be true in an individual sense. That's a very fear-based and absolute approach to what is a much more complex issue. Harm reduction centers people, their lives, their health, their futures. It uses peers, not police officers, to spread the messages of education and choice instead of abstinence and shame. What are the facts of a substance that you may choose to use? What are the risks involved? If you do still choose to use that substance, then what tools are at your disposal to make that usage safer? There's this mistaken belief that, if we teach abstinence, then only abstinence can follow. But by now we know that's not true, right? It's not true for sex ed. It's not true for drug education. Research studies from the 90s and early 2000s found that DARE did virtually nothing to alter substance use. And actually, one study found a slight increase in drug use amongst its students post-DARE. Harm reduction approaches, on the other hand, do have a significant positive impact. This work began in the late 80s as needle exchange programs were developed in an effort to slow the rate of new HIV infections associated with shared needle usage. Far from exacerbating rates of drug use and new infections, it was actually estimated that incidence of HIV infections decreased by 33%. In the context of the AIDS epidemic, that is huge. Similarly today, opioid overdose death rates are dropping for the first time since numbers began spiking in 2020, and a major factor for that is likely the flooding of Narcan throughout the country. Both of these initiatives clearly demonstrate the efficacy of harm reduction, saving lives by getting the necessary materials to the people who may need them. And if you think about it, we already incorporate harm reduction for certain riskier activities into our daily lives all of the time. I mean, we still drive cars, but we wear seatbelts to reduce the risk of serious injury in the case of a crash. We still go out into crowded public spaces, but now we wear masks to reduce the risk of transmitting or contracting a serious virus. And we still have sex, but we use condoms to prevent STIs and pregnancy. Harm reduction for certain riskier behaviors already exists all around us. So what makes harm reduction for substance use any different, any less necessary, if not for some kind of preconceived notion about what we think people should or should not be doing? This is why, amongst college students, access to these materials like naloxone and fentanyl test strips is crucial. Rather than pull the wool over our eyes and pretend that risky substance use is not happening on our campuses when we know that it is, we have to learn from DARE's shortcomings and understand that moralism and threats do little to actually curb substance use. We need to value people's lives above all else and give people the information and tools they need to protect themselves. College students are a vulnerable population. I mean, our brains are still developing, we're away from home for the first time, and we're exposed to and may choose to experiment with many new things, including drugs. According to the Substance Abuse and Mental Health Services Administration, or SAMHSA, out of the 9 million full-time college students in the United States, 6% used an illicit drug for the first time in the last year. That doesn't sound like a lot, but that is 540,000 students in 1 year, not including all the students who have already been engaging in this behavior previously. And it merits repeating here. People who have no history of substance use and who are experimenting with a drug for the very first time are dying of accidental fentanyl poisoning that one time. As the DEA's fentanyl awareness campaign is appropriately titled, "One Pill Can Kill." Now, earlier in my talk, I mentioned Nick Sheff, whose memoirs on addiction and recovery got me really interested in this field. I did successfully end up bringing him to campus this past October, getting to interview him as a part of the Solomon Speaker Series with Tisch College. It was the coolest thing ever, best day of my life. And one thing that he said has been echoing in my head ever since, one thing that I really wish every college student could have heard him say. You don't have the luxury of experimenting anymore. He made it clear that fentanyl has completely changed the landscape of illicit drugs in this country, and that if he were using today like he had been during his period of active addiction, he would not be alive because of fentanyl. He also spoke extensively about stimulant usage, which is high amongst college students. Common study drugs, pills like Adderall and Ritalin, which are notoriously made counterfeit and contaminated with fentanyl. So that means that any student who thinks that they're getting an authentic pill off of a friend or a friend of a friend could potentially overdose on it even the very first time that they tried it. This is why access to naloxone and fentanyl test strips on our campus is crucial. And while you can always get those materials free from thread, I want to highlight that as of today at Tufts, we do not have emergency Narcan available in the dorms, nor are RAs required to carry it, nor be trained on how to use it. So I want to let you think about that. The lack of knowledge and materials is a major part of this problem, but what I'm learning is so is this not me mentality. You know, I understand that this is happening to people, right? I see it on the news. Some unknown college student at a random university, but I'm smart, or my kid is smart, or my friends are smart, so that wouldn't happen to us. I thought that. My brother thought that. Now I have the unfortunate lifelong burden of knowing that actually, yes, it can happen to you because it happened to him. It happened to my family, to me. If you take anything away from this talk, let it be these 3 things. Number 1, that the fentanyl crisis in this country can affect anyone, including your loved ones. It's not out there somewhere, it's here. Number 2, that educating yourself and others about the facts of fentanyl and about the efficacy of harm reduction is the first push in combating this. And number 3, that actually carrying these harm reduction materials with you in your daily life is the ultimate push. Regardless of whether you use substances, carry Narcan and get your friends to carry it too. It actually doesn't matter at all whether you yourself use substances, because you don't use Narcan on yourself anyway. The sprays are small. I keep one in my backpack, one in my purse. I never even have to think about it. I just grab it and go. It's like seatbelts and condoms that are only effective when you actually use them. Narcan can only save a life if you have it when you need it. In its most undiluted form, harm reduction is love manifest. Carrying Narcan is an act of love. It's saying, hey, regardless of whatever I think about what you're choosing to do, I will not let you die because of that. Harm reduction has deepened my relationships because it's a philosophy for living. It's made me more tolerant. It's made me more empathetic. It's made me more loving. It has undeniably enriched my life and the lives of the people close to me. Now, let me be clear. I would give literally anything to change the timeline and bring Ben back. I dream repeatedly of him standing in the kitchen in front of me, back after some unexplained long time away, and I go to him and I hold him to me and sob out of confusion and relief. My brother's finally home. Even in waking hours, I can almost convince myself that there's been some kind of mistake and that he's out there somewhere and he just hasn't found the time to call. Or even that he's angry and he's punishing us with this ruse. But I know that's not true. And I know that he's gone. And there is nothing I can do that will change that fact. And that still knocks the wind out of me. So I'm here in front of you today because what else can I do? I can't bring him back. I can't repair our family. But I can tell you about him. And I can hope that you realize, and I help you realize, how this could happen to your sibling. This could happen to your best friend, to your roommate, your neighbor, your kid, you. At least if we don't keep taking action here. I have all this love with nowhere to go. And so now I put it into harm reduction in the hopes that you will join me in taking the steps to prevent this from happening anymore. For me, what this boils down to is the chance to live a full life with the people that we love, because not everybody gets that chance. There is so much that we can't control, but this is something that we very much can. So please join me. And let's protect that chance. Thank you.